Hi, this is Sunil Sharma. I'm the Director for New Life Surgical Associate, Jacksonville, Florida. So in this video, I will give you some information related to gastric bypass. Gastric bypass is one of the oldest operation, was first performed in 1967, and it's still being performed today in selective patients. So it is a gold standard operation for many patients. What is gastric bypass? It's a reconstructive operation which has two parts. In part 1, the stomach, which is a huge structure, is divided, making a top portion a small, which has about 10 to 15%, separated from the lower stomach, 85%. This top portion is called gastric pouch. Once this is created, then we bring the loop of intestine and connect this to the pouch, making a channel where which when you eat food, it goes through the food pipe or esophagus into the pouch and directly into the intestine. The part which is distal or remaining, we call it remnant, the 85% of the stomach, is still there and is functional. But the food what you are eating is not able to reach there. That remnant stomach is still producing all the juices, acid, and which trickles down into the intestine. So what's the difference? The food is not mixing with the juice or the acid. They are two separate channels until they reach a junction where these two tract or intestines are connected, making a common channel. So anything before this common channel where food and digestive juices and acid are not mixing, there is no absorption of calorie. So we call it malabsorption, meaning you may take 2000 calories and only 1200 will be absorbed. The other method gastric bypass works is when you create a pouch, which is the top 15% of the stomach. When it stretches, obviously it will stretch with less amount of food and it will send signal to the brain, giving you the feeling of satisfaction. So it controls your appetite. So it has two mechanisms, restriction and malabsorptive. So definitely it's more aggressive and have a better result in selective patients, although it requires expertise to do all this reconstruction. I've been doing gastric bypass for last 20 years and it's all done through laparoscopy, meaning through tiny holes, 4 to 5 in numbers. You can put the instruments and the camera, look at the monitor, do the whole operation. Typically it takes 90 minutes to perform the operation. More recently, about 4 years ago, I have switched completely to robotic surgery, where I perform the gastric bypass operation total robotic. And robotic surgery has its own advantage. It's much more precise because there is great visualization. The tissue handling is much gentle. The staplers are intelligent staples. There is no tremors, and it is just much more refined and safe operation, which translates to less pain, faster recovery. The staples are so efficient today that it is very hard or very rare to see a leak, which is used to be a quite not uncommon complications. The gastric bypass is done selectively to patients, either they have bad diabetes and their aim is to just cure diabetes. If their BMI is high, they may need a more aggressive operation. Or many times, if the bile is coming into the stomach, which causes biliary gastritis, then this operation can divert the bile so that it doesn't come into your food pipe and causes problem. So there are many different indications where gastric bypass can be the ideal operation. So during our evaluation, when you come to my office, we'll do a procedure called endoscopy, and that will tell us what is the best operation based on your anatomy. So gastric bypass has some potential complications like bleeding, leak. With the advancement in the technology and the experience of the surgeon, these complications should be minimum. The results are little superior than this sleeve for weight loss or resolution of medical conditions. If you need any further information related to gastric bypass, or you want to see if you are the candidate, please call our office 904-399-4004 or visit our website sharmasurgery.com and make an appointment, and we'll be happy to help you. Thank you.